Health Department has tabled its over 64 billion rand budget today for the 2022 and 23 financial year. 2 billion rand will go towards the procurement of COVID-19 vaccines as infections surge in South Africa yet again. Well, let's find out what else will be covered in that budget. Health Minister Dr Joe Phaahla joins us this evening. Minister, good evening and thanks for your time. Before I go into some of the issues you've raised in your budget, I want to begin with this. As we speak, the Health Department is, facing legal action over the implementation of the latest regulations that are governing this post-state of disaster period. Let's talk about the process that the department has undertaken to get us to where we are and your general sense around this different court action.
Well, I must say at this stage, I'm not aware that we are in court. What we have received from one of the parties is a letter of demand to get information. So that's where it is. Well, that's probably a prelude to a real court action. So, but just in terms of the processes we have followed, as you would be aware that over the last 2 years, the country has used the disaster management to bring in certain controls to limit the spread and impact of COVID. But then, of course, as the impact got less, there was a decision to say, let's exit the disaster. Of course, there was a lot of noise around that. Of course, after the discussions, Cabinet agreed that we should get out of using the disaster management and that health should use its own laws and regulations. That's the process which we started, published draft regulations, received comments about that. There were quite a number of those comments. And in the meantime, there was the interim of using the recovery clause of the disaster management. And as that was coming to the end, we then decided that rather than a whole package which we had published, we should just focus on the very limited kind of interventions which we require just to control further impact of the COVID. So we then published, following those submissions before we could conclude, just a limited package of provisions of regulations, simply focusing only on COVID and not the entire spectrum of notifiable medical conditions. And that's what we have in place currently. And if there's to be a challenge, that probably will be that. The broader package we then extended for 3 months further comments so that we could receive further comments, but and at the same time processing the 300,000 which we have already received. So that's where we are. And
it's particularly the process of publishing what you've described as this limited package of interventions that seems to be under question because, at least one of the groups representing a party like Action SA has said you didn't follow due process, that it was unconstitutional how these regulations ended up being gazetted in the first place.
Well, I think that's a matter for the judges to decide. We looked at our law, we looked at the provisions, and we are convinced that it is legal within the law which Parliament has passed, which empowers us to do that, to separate what is required immediately and what can be done in a more prolonged way. So that's really also in terms of the requirements of the period that we could see also that infections were rising, whether it's a new variant or not, but there was a risk, and we had to take particular immediate steps. So that will be really up to the judiciary to interpret, but that's what we believed with our legal advice, that it was quite completely legal.
I want to take a look at the budget that you have tabled. You've particularly raised concerns around the cuts that your department will be facing. Let's talk about what you believe the impact of these cuts will be over the coming over this financial year, rather.
Well, for the current financial year, I think we are quite grateful to the cooperation and support from the Treasury and the Minister of Finance. We believe that for the for the 2022-23 financial year, there has been not the best, but in terms of the circumstances of the country's fiscal position, we believe that we can live within what has been provided. The more difficult, let me say it again that it's not the most ideal. If things were better, remembering that actually even where we are, the level where we are, with a little bit of some increase, which the Minister of Finance mentioned in the budget speech, including for medical interns, for vaccines, and for a few other, matters which we can be able to do better. But overall, it is also a consequence of continuous cuts, even where we are. But we think for 22-23 we can survive. The worry is going forward, the next financial year, 23-24, 24-25, if what is in the projected allocation is kept that way, then where we have a 1.7% reduction in nominal, not even in terms of inflation, just nominal numbers being down, irrespective of what the inflation rate will be. So that is going to be quite a problem.
The impact of it, of course, is that you would be unable to fill some of the 21,000 vacancies that we believe exist in the department nationally. But it also means that there will continue to be a decline in terms of the quality of services that are offered by the health department and its associated facilities.
Well, definitely that's true. That's true that if that reduction is maintained, then you can see even currently in terms of just staffing, many provinces are unable to retain because there was an additional funding. We knew that it was just temporary for COVID. What it was called the presidential stimulus, as you mentioned, which allowed many of our provinces to hire additional staff, just over 70,000 all in all throughout the country. And you could see, remember just what happened a few months ago, about a month ago in Christiani Baragwanath Hospital, where there was this demonstration by health workers because a number of posts were being discontinued. So those are the things which will be a problem, but even besides the temporary post, it means vacancies, substantive vacancies can be filled. What that means across the board, health professionals, nurses, doctors, pharmacists, physiotherapists, and all the whole category, but support staff as well. That would be quite problematic in terms of the quality of service. And also equipment, just replacing old equipment, maintenance, all those things will suffer if the continuous reduction of budget goes on.
One of the biggest strains on the budget of a department like yours, Dr. Joe Phaahla, is the issue of medical legal cases. The department is spending way too much money on these cases, and unfortunately, they don't decrease with time. They seem to be on the increase, and they relate to the experience that patients have when they interact with public healthcare facilities, because then you'll have claims of negligence and all sorts of other matters that are lodged against the department.
Well, that's true. That's why I also in my speech I did mention that's a real drain on our budget. In some provinces, in one of the provinces, just in the last financial year, 21-22, they spent up to 900 million in terms of, court, litigation, where there were court orders to pay certain parties. Now, there's various levels of intervention. One, clearly, and it's a vicious cycle, because if you continuously understaffed, it means, the pressure is very high. The diligence of the staff and looking after each patient, it's also become diminished. Staff are exhausted and they can't pay good attention. So we want to, but there are some elements of just improvement in record keeping, in clinical management, which we are working on, just the quality improvement, which I've also mentioned, where a number of staff are also getting training just to improve quality of service, notwithstanding the pressure. But of course, if they're under too much pressure, then it becomes difficult. But there's also clearly a situation where we have found and evidence quite clearly, and not denying that there is, under this pressure, there's also negligence, but there's also unscrupulous kind of touting by some legal firms, where they go around looking for even non-existent cases, and sometimes there's collusion with some of our staff. Also, we found collusion in the state attorney's office, where certain cases are agreed upon that the state will not even defend, because it doesn't even come to the authorities to know. And then the court takes an order. And then the people, and some of this, that's why we've mentioned also some of them have been referred to the SIU. Some have already been stopped. So we are intervening on both levels, quality service, record keeping, management, but also on unscrupulous lawyers that we must also intervene.
With declining budgets forecast in the next couple of years, where does that leave the NHI, Minister?
Well, it's not good, because the success of the NHI also depends on strengthening the public health service, because even though ultimately the NHI is meant to bring together the resources in the currently in the public and that in the private, to bring all those resources increasingly, because we know it won't happen over one day, but increasingly the idea of this pooling of resources is that even what me and you who are on medical aid, I hope you are, I suspect you are, most of us who are employed to join medical aid, is to bring even that money into one kitty, so that it can bolster the benefit of everybody. But we also quite aware of the fact that the bedrock of sustaining even a combined integrated service is the current public service, which caters for 85% of the population. So it does weaken that in terms of even just the confidence of the people in that 85% of the service, because even though the private service, private health, spends equally half of the fiscus, of the GDP spending of the country on health, it only caters for about 15% at the most. But the bulk of the population is carried by the public health. So if there's a decline, that platform which carries the majority, then is going to be a problem. But it does not mean that we can't continue preparing the platform. It just means it makes it more difficult.
I suppose those preparations are going to be extended yet again, despite the fact that already even the conversation around the NHI has, a bit of a stop-start over the years. The Health Minister, Dr. Joe Phaahla, we'll leave it there for tonight. Thanks for your time.
Thank you.